we are not mobilizing enough money to meet our SDG financing goals. And to that end, we've got to be thinking, how do we get creative? Aid to Africa is reducing. We've seen a massive reduction in aid, up to 30% in some countries over the last 5 years. We're seeing governments struggling to fund aid service provision through their budgets. And so one of the options we've got to think about is where we're going to get money for this. And to that end, we've got to think about how the private sector comes into this play. So the Africa Funders Forum is designed to exactly try and help facilitate funding of the African healthcare space, and especially trying to find sustainable financing to the entrepreneurs who are trying to address the Pan-African challenges through innovation. So to that end, this forum will try and accommodate about 80 investors, but also about 30 social entrepreneurs into a single program, and it will kick off in September with a formal program. And after running for 14 weeks, from January, we'll kick off the formal forum process, in which we're going to try and give everyone an experience of what it means like to be in a community of practice. We'll share knowledge, we'll share investment opportunities, we'll try and organize site visits, we'll visit institutions that are advancing the African healthcare agenda. So that's kind of what the forum will be about. And then the Impact Leadership Program, as I mentioned to you, will start off with a 12-week led webinar series, each about 90 minutes. It will include healthcare investors deploying grants into this space. We'll try and work through to make sure that we have a good diversity of people from foundations, impact funds, governments, DFIs, and aid agencies, and corporates as well, that will be part of this program. And at the end of it all, we'll hopefully recognize all of you as African healthcare impact leaders. So on to the next slide. This, as I mentioned to you, is a forum that will be restricted in terms of size. So the class size is limited. So it's a matter of please join as soon as possible. Apply for the forum spots, and then we'll hopefully admit you as soon as possible. And the cost is about $1,500 for the forum. The people who are going to be behind some of the forum, you can see them on the screen now. These are some of the faculty who will be facilitating the forum. So we're super excited to be doing this program with some of these folks from Social Innovation Circle as well, many have had experiences, extensive experiences on the continent. Next slide. And as AVPA, this is part of a process of trying to see how we can mobilize capital for impact. And the second webinar today, which I'm super excited about, is carrying forward the conversation from the first. And I'm very happy to have with me two speakers, Leah Kibe, who's Director of Co-Funding and Partnerships from CIF, and Abimbola Adebakin, who will be joining us in a short while, who coming in from an organization called My Medicine. Without further ado, let's get into the intros. So Leah, if you don't mind, do you want to just introduce yourself and then have your camera on and tell us a bit about the work of CIF in this space, why this is an area of interest to you, and we'll go into the conversation from there. Leah, over to you.
Thank you, Frank. Really excited today. I think we were just discussing, are we having a fireside this early in the morning? But yes, it is cold in Nairobi, so I'm right by the fire with my cup of tea and happy to have this conversation. So the AVPA network joining this conversation, Ashoka, Boiringa, Ingelham, the Social Innovation Circle, and everyone else that's joined us for this chat. Good morning, and I guess it's also possibly good afternoon to others. Frank, thank you. Yes, my name is Leah Kibe. I'm the Co-Funding and Partnerships Director for the Children's Investment Fund Foundation. And thank you for having us join this panel. I am excited. Africa is central to my heart, but also quite honored to be part of this conversation and to represent the foundation. So I could say a bit about CIF. And CIF we are an independent philanthropic organization. We have our offices so far in Addis, Beijing, London, Nairobi, and New Delhi. And we deliberately work with quite a number of partners, more centrally to transform the lives of children and adolescents. In that same light, CIF has been in Africa now for over 15 years. And we say that we deliberately increase our level of localization, on the ground solution development, and leadership. So leadership is central to us, and really looking at how to make Africa quite different in the interventions that we fund. I say we are a catalytic funder, and our priorities and investments will focus on the girl, and very deliberately pegging on building systemic solutions that have a clear pathway to sustainability. And our approach and general model, three work streams really embed the clarity of how we approach country investments. One is the clarity of the demonstrated need, the probability of its success, and the existence of collaboration. So our model is a commitment towards meaningfully partnering with Africans, our governments as solution bearers. And this really comes from a point of, if the problems are really local, we are looking for solutions that have really been derived by those closest to the problem. So in both the core design, execution, and also core investment. And I believe that then we'll all be working towards shared priorities. I think another thing I would want to really call out in terms of how our success is significantly accelerated is we centrally anchor it on integration. And it really goes back to calling out not really transactional investments, but investments that are designed and really deliver holistic solutions. I also mentioned that localization is part and central to that design. And this helps us keep moving closer and more accurate towards context-specific investments. And this is really supported by our CIF team that's quite local in the country offices, but also a very deliberate network of strong partners. And this partnership transcends into execution, the building of evidence towards impact, and that ultimate sustainability. So where is CIF and what's CIF's sectoral or strategic priorities? If you put the girl at the center, and the girl being our primary focus, think about that girl over her life cycle. And that's a space where CIF will be. Right from birth to actually getting the girl to survive, but not only just surviving, but also thriving and connecting towards education, livelihoods, and the ultimate opportunity to make health choices, moving towards sexual reproductive health. So Frank, maybe I would say in conclusion is that we, as a catalytic funder, we are ambitious. We look for large scale change, but embedded within a very clear pathway to impact. And this pathway and conversation that can be actively monitored and measured to really drive us towards new policies, new large scale programs, innovative delivery, but also very dynamic delivery models.
Thank you, Leah. I'm really keen to follow on, especially on a couple of things. One, the context-specific stuff that you do and your role as a catalytic funder. because these are some of the issues that we are looking to address as AVP as well, and make sure that we are driving solutions that have context to the African environment. We're supporting local entrepreneurs, but recognizing that there is a really unique place for catalytic investors like you to come into play. So I'll circle back to you on that in a short while. Next, I'd like to bring on into the conversation our other speaker, who I would ask to introduce herself in a short while. Abimbola, are you there? Can you please come online, and we're just going through the round of introductions and what your work entails before we go into the depth of the discussion today.
Hi, Frank and Leah. Thank you very much for having me. I apologize for the delayed joining. So my name is Abimbola Adebakin. I'm founder and CEO of My Medicines. What we do at My Medicines is to bridge a gap that we identified a few years ago. Too many times people wander around from pharmacy to pharmacy trying to fill a prescription. You might get a prescription from a hospital, or you need an over-the-counter medication and you need to go to 2 or 3 pharmacies. We bridge the gap by creating a solution that involves logistics, that involves using tech to identify where the pharmacies exist and what inventory they have, and then linking that with supplying at the last mile. So My Medicine actually makes medication available across all the states in Nigeria. That's about 774 local government areas. And we've been doing this for about 5 years. We've done over 50,000 of such, and we're growing in a manner that would help us to do more of that.
Thank you. And so how big is the organization in terms of people? When you do get it started, and what's your reach at the moment?
Okay, so My Medicines is one of the ventures under Advantage Health Africa. It's like our flagship venture, but we have a team of 75 people right now. We've grown since 2017 to 75. We have been able to deliver in 33 states of Nigeria. Just for perspective, Nigeria has 36 states and the federal capital. So we have delivered across the north, south, east, west, central areas. And we have a network of almost 1,000 pharmacies who are in our network that we've created. Some we own, some we manage, and then the others are affiliate pharmacies. And what we've done with them is to create that, inventory bandwidth. So I can say we have a spread across the country. We have delivered in 33 states, and we're able to reach any village, any town, any city in Nigeria.
Okay, Abimbola, I'd be very keen to see actually how you've gone through that, especially around stuff like creating a sustainable business, how you do data collection, how you track your business through that process, because this is all about some of the challenges that I anticipate many people are trying to deal with in terms of driving healthcare provision on the continent. But before we get there, Abu, we've got one more audience check we want to have. Can you please bring that up and let's see what the audience thinks about this. So once again, using Slido, for those of you who are joining us, take your cell phone, scan the QR code or go to slido.com. Just in your opinion, what is the biggest barrier or challenge to Africa achieving its healthcare goals? What do you think, in your view, and from where you work and stand, is the biggest barrier? We'll take about 30 seconds to get these results in. So the good thing about this is that this comes up live, so we can see exactly what the audience thinks. Abu, do you want to scroll a bit just to see what the last question looks like? Okay. Okay, another 10 seconds. Okay, good. So it looks like the general feeling is it's around three main things. It's about financing or funding. It's about implementation capacity and the lack of Afrocentric solutions that are very grounded in the context of Africa when you look at innovation. So just if I come back to you, Leah and Abimbola, first of all, you know, your general response to that, those sentiments from the audience, and then secondly, what from your space are you seeing as some of the emerging trends, whether they're threats or opportunities in the African healthcare space that we need to be paying attention to? So first of all, your just reaction to the audience's response, and then secondly, when you think about emerging trends, whether they're threats or opportunities in the African emerging space, what are you seeing that we need to be paying attention to? So Leah, do you want to go first?
Okay, sure. Frank, this is not surprising. I think a greater thinking is that there is inadequate funding, and I do, to one extent, agree to it. But I want to respond to that with data, because what has surprisingly changed, especially post-COVID, is there's been a lot of funding that has gone towards healthcare. So I think the question then now is, are we able to connect 1 and 3? Because on one side, you can see there's now quite a concerted effort to fund and take funds towards healthcare. But are we on the other side seeing who is really demanding for this healthcare, and who are these Africa dynamic thinkers with innovations and solutions towards it? So I'm not surprised about the funding comment. It is a reality on one hand, but I think it's a reality that over the last 12 to 24 months, we've seen quite an emerging change. And I'd like to respond with that with specific data, because data, I had actually selected number 4, because data gives us quite good realities. And I'm reflecting on a report that was issued out by IFC, where they're actually now estimating that over the next decade would be about 30 billion US dollars in new investments towards Africa's healthcare needs. And also, alongside the funding and the financing views, is that with the COVID pandemic happening, the strengths of our healthcare systems were really put to test. And a lot of that came out, that we could see what we were deficient of, and also our preparedness to respond to certain pandemics. And the movement of funding within the healthcare space and putting funding where it was most needed, the connecting between the supply and the demand was one thing that came out. And hence, I'm also agreeing to the point that funding still remains an issue within the healthcare space. But also surprisingly, is that last year, there's a record of about $5 billion US that was raised towards startups. And of this, only 8% went to health and biotech, and a staggering 62% went to fintech. And yet, surprisingly, this is a point when the health system was really being tested. So I come back again, does that mean that we may not be having sufficient Afrocentric solutions and thinkers because when you compare 62% of funding going towards fintech and only 8% going to health and biotech startups, then I question myself on item number 3. But that's not to dampen it, because it is also, Brighter Bridges also did bring together a lot of data as far as actually telling us that about $400 million of funding went to healthcare, and this is actually an 81% increase from 2020. So we can see that there's been a significant spike towards funding healthcare. And I always like data, because out of that spike, the biggest portion of the funding went to health supply chain. So for me, quite exciting views of how funding moved, because these are the trends, not only from a financing perspective, but also tells you on the supply side, there's been a significant increase of funding, but on the demand side, equally, there's been an increase of funding towards, or thinkers and solutions towards healthcare, but maybe not at the same exponential as the funding has been. Yeah, so I think for me, that's a quick reflection of what it means. But also, as I reflect on these trends over the last 12 to 24 months, the healthcare itself, and here I would want to say, when I speak to healthcare, I actually look at it from a health system strengthening perspective. It's not just only service delivery, but we're really, as CIF and as a foundation, we look at healthcare, that we should achieve goals where we improve health and have better health outcomes. We are also responsive to the health system needs. We're also looking into financial risk protection, which is the whole health financing conversations and dilemma that has been with governments and citizens like myself, and ultimately improved efficiency. So we're not only just looking at healthcare for healthcare, but really discussing this alongside the WHO building blocks of health, which is those the health system strengthening lens. So coming back to that, my parting shot on, or my call to action from what we have seen as trends, not only should we be really focusing our conversations on strengthening the health system, but equally there should be efforts towards building health system resilience. And this is through local, national, and global engagement.
You're muted, Frank.
Frank? Oh, yeah.
Sorry. Yeah, sorry. So apologies. So for the audience, please respond to the speakers' comments on the chat with any questions you may have. So I'm glad to see Doris has posted one, and I'll get to your questions throughout the session, and we want to make this as interactive as possible. So by all means, if you've got any questions or comments to what you're hearing or what you're seeing, please post questions there. So the one thing I just want to echo what you've said, Leah, is it's a big question we get at AVPA all the time, is do we have more money in Africa than we have investable opportunities? Is the problem the supply of capital or the opportunities that can absorb the capital sustainably? What's your view around that? When you look at it, even at a systemic level, do you find even our governments or our entrepreneurs are able to, are you spoiled for choice in essence of where your money could go to create change?
Good question. And Frank, it comes to my question of, do we have data that tells us what's in the supply side and what's on the demand side? As a catalytic funder, meaning our sweet spot and our space is really to explore areas where everyone else would think is risky. I would say we struggle with Afrocentric solutions. We struggle to really get inspiring ideas and thinkers that will move the needle from the deep-seated challenges and problems that our people in Africa are facing. So I just directly responding to you, we struggle with number 3. Yeah.
Okay, that's really good to hear. And if there are any entrepreneurs or nonprofits in the audience, I'd love to hear your thoughts around that. Do you feel you struggle to connect with potential funders? What we hear as AVPA is extensively that we don't have enough investor-ready opportunities, especially social entrepreneurs who fit the expectations of many investors. And that's something we're hoping that we can address as we go along. But also the other reality, and that's why this Healthcare Funders Forum is really important. It's not always just about the fact that the investees or the entrepreneurs or the NGOs are not ready to receive capital. It's also that from the supply side, we don't come with enough flexible tools to be able to fit the kind of entrepreneurs that we find in Africa. So it's very important for us to also, as part of this forum, one of the things we're going to be trying to do is expand the understanding of investors and knowledge around innovative finance and impact investing. How can they package their capital differently rather than just come with a traditional grant debt or equity? What other tools like revenue share models, outcome-based financing can we apply into the healthcare space? So that's kind of the stuff we're gonna be trying to do as part of this Healthcare Funders Forum. But it's going to be a learning journey. We're in a space where this space is very nascent, it's very young. And we want to learn from each other. So this will be about building a community of practice that we not only learn from each other, but we co-invest, we collaborate, and build a strong Pan-African community of healthcare that is also then easy to identify and support. If we find people from outside like Leah who are coming and wanting to plug into an existing African healthcare network, it's very easy for us to identify who those are and who the group are. Doris, I'll come to you in a short while, but before we go there, I just want to have Abimbola respond to the same question and hear her side of the story in terms of, first of all, Abimbola, just your reaction to this comment from the audience. And then secondly, what are some of the trends you're seeing that are worth paying attention to when you look at the work that you do in Nigeria?
Thank you. I do agree with most of the points by Leah, and I will hone in on one of them, which is around the capacity to fund with just because there's lack of data. I know a lot of people doing good work, but you just have to go below the surface. I used to work in an entrepreneurial development company. I was the chief operating officer before Advantage Health Africa. And I know the work we had to do to just get people in sectors to come out to showcase their work. We had to identify 1,000 entrepreneurs every year. And at a point, we even had to encourage female entrepreneurs in a separate manner just so to get them to come out. So there is a work to harvest and harness those who are doing investable work to come out and step forward and be showcased, or even to have a conversation around what kind of financing do you need. I don't think it's because we don't have, just that we need to identify them and bring them out. So that's maybe the part I say, when I see there's no data, I say, well, there must be interesting instruments to use to find the data around who to invest in. But in terms of whether we have enough Afrocentric healthcare innovations, we have a lot going on, but where they're not connecting end to end. If you look at the pharmaceutical sector, many of us are funded at the services end, but we need much more funding up in the value chain for production of local ingredients, local excipients, active pharmaceutical ingredients here in Africa, here in Nigeria, to be able to say we have a solid or a resilient pharmaceutical sector. Right now, our over-reliance on importation makes our healthcare goals a fallacy. Nigeria, and I dare say a lot of Africa, is over-reliant on importation of medication. Medicines are needed in at least 80% of interventions in healthcare. And if you do not produce medication, then we cannot say we are achieving our healthcare goals. It's just, the connection. So we do need a lot of funding up in the value chain. But in the lower end of the value chain, where we're creating services, where we're creating last mile solutions, where we're giving pharmaceutical care, where we're giving clinical care, physiotherapy and all of those, they're beginning to see more investment. We're beginning to see more interventions that are deep-pocketed and are actually achieving growth. The third point I wanted to make is really around lack of implementation capacity. I come from a health background. I'm a pharmacist. And I know that until you come out of school and work for many years, you are unable to acquire the organizational design and capacity to run businesses beyond an idea. Too many of us in healthcare creating solutions do not have the strong background for implementing these solutions to the scale and to deal with the complexity of building it out as a formidable business. When investors then come, they don't find investment ready entities, because the promoters are more professionally inclined into medicine or pharmacy or physio, and not so much as into building out a business. So I encourage a lot of, when funding is coming, implementation capacity must come with it hand in hand. Otherwise, the fund comes and it fizzles out, and it does not encourage repeats or further investment. So capacity is such a big deal, especially in health. I see a lot of money going into fintech. It is probably because those who are funding have a background in finance already, so they can relate so quickly to their colleagues or their contemporaries who are promoting fintech. Or who is relating with those who are promoting health and health tech? Fintech and finance. So the language also differs. Therefore, sometimes those of us in health have to begin to speak the language of those who are coming to fund us. Some people don't know return on investment. Many of us don't know what EBITDA means. We don't really know when you're saying you want to understand the cost of acquiring a client. What does that mean? For us, clients are sick, people are ill, they need healthcare, and you're telling us cost of acquiring a customer. What does that really mean? The terms that investors are looking out for are foreign and strange, so we're not speaking the same language. So implementation capacity and knowledge, enhancing our ability to access the funds that exist is a big deal in healthcare. And I think when funds come, there is a need to look below the surface, that there is much more work that needs to be done to discover the gems that are here. One last point from me is around the formation of those who are starting the businesses. I read a study recently about innovation in distribution of pharmaceuticals. It was done by Salient Advisory. And they discovered that many of those who are accessing the funds are either male-funded businesses, or those with male-female founders, or those with foreign training, or those who have a foreigner. When I say foreigner, non-African, preferably a Caucasian male in their founding team. So sometimes we also need to study the patterns of where funding goes to. And so when Africans say there is no funding, there is funding. It's just the type of funding and who it is chasing and when it is needed. There's so much to talk about that, but I guess I'll mention some more as we go along.
And Abimbola, you raised some really good questions. The need for us to mobilize more local capital that has local context and appreciates the challenges of local finance. We can't keep depending on foreign investments to come and support our local ideas. So that's a very important thing we need to do. Another thing that's, I think, very important in this situation is how do we change the mindset about the opportunities in healthcare? I think for many years, healthcare has been seen as a sector for public good, where it can only take in government funding and grants, that kind of stuff. And people haven't thought about healthcare as having entrepreneurial opportunities and where we can create entrepreneurs. And so the whole concept of profit and purpose in healthcare in many people's heads doesn't apply. And that's a mindset we've got to shift. We've got to make people understand that you can do well as you do good, and healthcare is part of it, which then takes me to the point of, if you went to many medical schools, no one probably has ever thought of running an entrepreneurial class or an entrepreneurial elective to medical students, whether they're doctors or pharmacists, because they're almost perceived to just go and get employed, but not to be entrepreneurs. There's someone in the audience who I'll ask to speak in a short while, called Obi Malope, who's become an entrepreneur in the ophthalmology space. But I think, and Obi, I'll love to hear your thoughts about this. This has been out of his own initiative, but we don't think about deliberately investing in healthcare entrepreneurs when we know, for example, that some of these people end up being unemployed in any case. So they don't contribute to the healthcare workforce that we so badly need in that context. So those are really good.
Can I comment? Can I comment quickly on the point you made about going back to school to give the entrepreneurial foundation? It is actually the reality that in medical school, if you don't go clinical, if you don't go to become, a senior reg and so on, you're thought to be a failure. It's actually actively discouraged and covertly discouraged. It's almost as though you fell off the bandwagon if you become an entrepreneur or become anything else than what your professors are. They're so godlike, that you want to mimic them and emulate them and go the way of being, a reg, senior reg, and so on, a consultant. So those like Obi that you mentioned they're like the deviants. They had to break away. They had to work on their minds, because your mind wants you to conform. So those of us that have had to break out and still retain our healthcare background, it's a struggle to still say, I am a success at this thing that I'm doing, and the health sector and the health system needs more of us. We're not saying it's not good to go clinical, but we must balance the ratio. So it's actually a very strong point for health and health tech to thrive. We must create a stronger pipeline of more of us coming out in the non-traditional path of building a career. Then maybe then we'll get a bigger pipeline.
Okay. Before I go into a bit more depth in the funding side, Doris Macharia, you asked a question. Can I ask you to unmute and just maybe expand on your question, or ask it to the speakers and make a comment?
Yeah.
And also, Doris, can you just introduce yourself?
Yes, yeah. Thanks so much, Frank. Hi, everyone. Hi. Doris Macharia. I'm with Orbis International in the area of healthcare. And I was just, as Abimbola was speaking, I was just filled with all the guilt, because I was one of those, get into med school, do everything clinical, and then decide to go into a different path. But I'm with Orbis International. We are in the business of eye care. But I think for me, it is really around, I was looking and thanks so much, Len Abimbola, for just expounding on this. It's really around, for me, the data use, how we are not necessarily, really making the investments in terms of how we're using data to help us not only make decisions in terms of where do we need to go next, but also getting out of what you're calling, Frank, in terms of grants. I mean, right now, many of organizations that I know, many entrepreneurs, etc., if you have to talk about, financing mechanism, everyone knows how to, if you get a grant, I know what to do, I know how to report on it. But when you start talking about performance-based financing, you've lost people. You've lost people completely, and people sort of shy away from that, and they actually don't realize that there is something to be made there. You can achieve your goals, but also keep your company afloat and also make a profit, right? At the same time. But you need capacity, you need training, you need all the things we're talking about in terms of time. Point number 2, not only implementation capacity with regards to the actual healthcare delivery service, which we've become really masters at, but the back end of it, how do you make sure that you're not losing money? And how do you make sure that, you have the staff that can really translate and get, the funds and be able to implement and be able to report and be as, I'm trying to get the right English word, but be good managers of the funds that we have. So for me, it's just those two things. But I think for me, my last point, as I was making here, was, are we also not, where are the other areas in healthcare that just because you have all these organizations and funders who are funding particular areas, are we also not neglecting areas? Just because they're not funded does not make them less important. And I think that is also, for me, very, very critical, because going back to when we're talking of Afrocentric healthcare, we know, if you have this particular funder, they want this area, then we all sort of run towards that. I mean, it's good for us to do that, but at the same time is that, are there other healthcare areas that are not receiving attention that we need to call attention to and make sure that we can match ourselves with those donors? Because it's not that easy to sort of match and figure out where the donors are and how do we connect with them. I can tell you it's a struggle for many. I hope I've not gone round and round, Frank, but I really appreciate this opportunity and just want to thank you for this, I think this forum to really be able to air and learn and hear out, I think the experts here. Thanks.
Yeah, and Doris, I think this is the interesting thing about this space, is that this whole space we're getting into, where we're trying to bring together the traditional extreme spectrum of the aid and private sector into this middle blended space, is all very new to all of us. So we're all learning. So you're learning just as much as people in engineering, in fintech, and other areas in terms of how we can creatively mobilize and deploy capital for impact. And that's what we're trying to do as AVPA, to support this capacity building, for lack of a better word, and knowledge enhancement. So you'll see we've got a program, for example, on impact investing, fellowship program that is open now for registration. So those of you who are interested in understanding a bit more about the impact investing space, there's a program that we've opened up for registration to start in September. So please go check our website or get in touch with us when we'll post some stuff for you. But in essence, this is the time for us to do this. And we're very fortunate. I keep saying Africa is a sandbox of impact in the world. We have the most extreme challenges, but also the most exciting opportunities to test some of these new models and approaches. Leah, do you have any reaction to Doris's comments?
Yeah, Frank, the peculiarity of healthcare, it's, I think, and reflecting on data, why basically what Abimbola and Doris was saying, it's easy to access financing and get private sector into other sectors, but healthcare is quite complex and quite unique, because not only are we trying to stay afloat as private sector to make profits, but also work alongside a purpose. Healthcare is a public good. And a public good means that governments are really responsible for healthcare, providing healthcare to its citizens. So it even calls for such greater partnerships and synergies with funders, yes, with private sector, yes, but also with governments. And also, like if we think of funders, and funders, especially like us, who play a catalytic role, and everyone in that ecosystem, there's also a part of it that calls us to make sure we're doing no harm. Because the ultimate reason why we are moving into and trying to resolve the healthcare issues we have goes to improving health outcomes, responsiveness, financial risk protection. Families don't have to bear the burden of what COVID costs people to cover for, or any medical situation. So the uniqueness, even as funders, as we think into financing, is that we must do no harm. So that's one thing I would say, even as we're having these conversations, looking at data, looking at where financing is coming from, looking at how we can think through innovative financing models, looking at how to attract private sector and to have a meaningful collaboration. Ultimately, each one of us is called to do no harm. And that's where governments really have to come in and keep making sure that this is a public good that is delivered to our citizens. Yeah.
And that's the interesting thing about healthcare. So we still have this mindset, I think, amongst many of us, that healthcare is purely a public good sector. But if you think about the investment opportunity, there's $66 billion worth of investment opportunities in healthcare that can offer people, the private sector to come in and actually invest in this space. And it doesn't necessarily mean that when you invest in as a private sector player, you're necessarily making super profits or making your services unaffordable. No. And this is where we keep talking about the convergence of profit and purpose. Those are not mutually exclusive. And that's a big mindset we're trying to drive in amongst the private sector players, that you can come and invest in healthcare and other SDGs and do well as you do good. And for the traditional public sector or grant driven part of the spectrum, to not think only about absorbing grants. There are some solutions in there that have commercial opportunities that can then lead to more sustainable interventions and long-term solutions, as we think about sustainable financing of healthcare on the continent. So those are some of the things I think we need to think about. Leah, can I ask you, can you stay for another 15 minutes, Leah? Or are you very time stuck? Okay,
no,
excellent.
That's fine, Frank, yes.
Okay. Yeah, so for the audience, I know we booked an hour for this, but this conversation has become very interesting. I'd ask you to, if you can, please stay for 15 minutes. I just want to engage the speakers on a couple of things, but also field a few more questions from your side with regards to what else we can be looking at in here. So on that note, what do you then view as we think about all of these things, recognizing we don't have enough money to fund healthcare, the private sector is still not interested in this space as such, governments are broke. Do you see an evolving and changing role for philanthropy as we think about how we pull in more funding into the healthcare space?
Yeah, definitely. Yeah, I think we are definitely living in some very peculiar times. We've had some realities set in such that when you look at how well the public sector was financing healthcare, we had the COVID stresses of macroeconomic situations. We're still living through some geopolitical, macroeconomic, financial strains. Governments are still working through debt refinancing, etc. So I think it's really a time for philanthropy to step in and keep catalyzing this sector and this system. So, but I still go back to data, Frank, again, because data really sets our mind. And what has happened over the last 2 years in Africa is we now have about 71% of philanthropists in the continent that have increased giving and are also actually looking at their focus areas being healthcare, economic resilience, and food security. And as if we think of ourselves in a unique place to catalyze what Africa is prioritizing. And that's very central to us. And because that really calls for development trends that will definitely be sustained beyond our funding. We are only coming in to catalyze what Africa is prioritizing, what governments are prioritizing, and if there is an ecosystem of African philanthropy that at a rate of almost above 70% that have increased funding towards healthcare, towards economic resilience, and towards food security, it's very attractive to us because it means there's a lot of alignment in priorities. So what's the role of philanthropy? There's one side where we keep the lights on, and meaning that we are still delivering what our citizens are demanding, what myself, my mother, my uncle, everyone, what we're demanding of healthcare. So we still have to keep the lights on. But there's also an emerging point that I raised earlier. Health systems have to be resilient. I think we're coming in a situation, looking at the local context, how African health system has been strained by COVID and by all these geopolitical pressures. So another role philanthropy is really looking into is how do we make health systems resilient? Because the lack of it would take us miles back and it will be much more costly than what we had spent before. Then I would say the third point is philanthropy is not scared of by risks. So we are uniquely placing ourselves in that continuum of funding that Doris was mentioning, at the point where we are happy to start races, we are happy to explore new innovative delivery mechanisms. We are happy to get into any space that everyone else would think is risky, de-risk it, but sustainably connect that solution to the next line of funding. So I would say those are, in the last few years, those are the three spaces that philanthropy can really play in.
Well, I'll come to you in a short while in my next question, just around your experience in raising funds as an entrepreneur. Just to build on what you've said, Doris, one of the things we've also seen as an emerging space for philanthropy, and building on your point about philanthropy sitting on capital that can take a bit more risk, is how can philanthropists, in my view, play that emerging role of testing new markets, new products, new services, taking that kind of risk that more commercial capital cannot take. I'll give an example of if anyone is interested in this, please let me know. I'll send you the case study. But there was a business in Mexico City that was providing diabetes services in an urban setting. And some philanthropists asked them, why don't you try and test this model in the rural areas? And they said, no, it's too risky for us. We can't do it. So what the philanthropists did, they said, I will fund your model, your time to go and test the model in the rural areas. So he gave them something I think was $300,000. They went out to the rural areas. They tested the model. They hired people, built offices or rented offices. And they found that with a couple of tweaks, they could deliver that model in the rural areas. So the philanthropists took the risk of the transition of that business to go and test a new market, being a rural area. And this is where we talk about the blending of finance, for example. How do you blend grants and commercial capital? And upon that period which the philanthropist was funding this project, they found that they could actually run this business in the rural areas, and they then invested more commercial capital for that. So that's kind of some of the role that philanthropy could play in how do we help crowd in private capital in some of these spaces. But Abimbola, just from your perspective as a social entrepreneur, what's been your experience raising money? How easy, how hard has it been? Just what's been your general experience?
Okay, so I was quite fortunate to have tried to raise money when there was some interest in funding startups. And this interest arose with a more formalized angel network. So angel investors were beginning to put themselves together and inviting pitches. And I pitched to one, from there got referred to another. And at that other, I met someone I had known when I was working as a management consultant, and they took interest in my business. They liked the determination to succeed. I think they took interest in the team, and they were keen to also test a model that I was coming up with. I felt that with backward integration into the pharmacy space, we could strengthen the supply side, strengthen providers, and then ultimately create better healthcare for all. And that was the investment. Let's invest in you. We trust you. We think you're going out of the norm, and you will get to the grassroots. And we tested the model. With that funding, we got from angel investors and some VCs. And the good thing about it was the investment was in the entire venture. So we created a holding company so that my medicines, my pharmacy, pharmaceutical distribution, everything could come in, and the investment came through. So sometimes the risk with one venture is de-risked by the fact that it's the entire ventures that were invested in. Today, our most profitable and most revenue driving arm is the pharmaceutical distribution. But the interest is that soon the health tech angle will pick up and do much more than it is doing. And we need such patient capital for some of these things that we're innovating around and, testing, exploring. Too many of us have, funding from commercial banks that are too short-term focused. And if you can't give, the repayments and the returns, you're stuck and you can be totally embarrassed. So I think that patient capital is what we need in healthcare. I got patient capital. Today again, we found that our valuation has gone 6x and we're able to now we were approached, for funding, and now we're going through another round of funding. The important thing about this time is that it's local again. The first one was local. I was very particular about it being naira denominated. I'm glad we focused on that. Again, today, we're raising naira denominated funding because of the way our foreign exchange volatility has affected businesses. So that's my experience. We also do raise capital from banks, that's the debt, but it's so expensive. And you want to find as much as possible low interest commercial people funds, but they are very scarce. So sometimes when we say, come and fund healthcare, it can pass through the banks, but if it can in any way lower the interest rates or help to de-risk, then we can access it for working capital. That's because we do some commercial work in healthcare that needs that kind of working capital. There's so many ways to fund entrepreneurs. Grants are very beautiful, but we need more large sums for working capital that can sustain businesses and help us to grow the revenues. I know I'm going beyond the question, but I think one of the distractions is that, oh, there's too many that are too small. We need them to scale. We need them to scale. I think fostering collaboration will help to scale. Fostering big strategic partnerships will help to scale, but also fostering long-term large sums that are commercial, but the terms for accessing them are gentler, especially because many of us are building asset-light businesses. Yesterday or 2 years ago, we had a meeting with a banker that wanted to come to fund us, and then they put in their traditional requirements of assets, collateral. And I said, I don't have that. I don't even need it with an asset-light model. But what you're trying to force me to do is to go the traditional way, but you have to rethink. Many of us that are emerging are innovating even around our business models. So you, the funders, need to innovate in the way you bring. Otherwise, your funding is for the old traditional businesses and not for us. We can't talk.
Abimbola, I totally hear you. I'm trying to do something at the moment and get a service provider who's insisting that we must have a physical office with a signboard and everything. And I'm thinking so many businesses are virtual today. Yes. And this is what I was saying, Abimbola. I totally agree with you that it's not just about fixing the demand side and making more business investor ready. We also have to have the supply side getting a bit more flexible with the number of the options of kind of tools that they're bringing to the table. And so it brings me to our last two questions, because this is exactly what we want this Funders Forum to achieve, is how do we capacitate and improve, one, from the supply side, the knowledge that investors have of the different types of investment tools that they can use at their disposal, and not just stick to you're right, collateral, debt, grants, or equity. What are the other options, a combination of some of those that they can apply in making capital more flexible and deployable to you, especially delivering impact in healthcare? And for the demand side, also, how do we then connect and create this community of practice that brings together, the social entrepreneurs and funders? So just my last two questions for you, Leah and Abimbola. So as you think about a forum of this nature that we're trying to build, why do you think this is needed, and why now? Do you feel this is the right time for us to be looking at this kind of community of practice that is really trying to enhance the investment practices and collaboration between not just investors, but investors and entrepreneurs? So Abimbola, this time I'll go with you first before I go to Leah.
Absolutely, it's necessary. One is we begin to share success stories. And one of the things that success does is triggers more success. If I share what I'm experiencing in Lagos, Nigeria, I could find someone in Ghana or someone in Nairobi or someone else in Uganda that has similar challenges and sees that Abimbola is succeeding, then they're more confident and they can step out and do more. If I'm accessing finance from angel investors, someone else in Sudan might say, okay, there are local angel investors. If we can't get foreign exchange to come in, we might be able to raise things locally. So sharing success stories, being able to model after one another, fosters that momentum that we need across Africa. Africa is not that deep, dark continent. When we are in here with it, we can see ourselves succeeding, and we need more of that being championed. But also on the flip side is we share our challenges, and you might find someone creating a solution that can now be taken up by 50 of us or by 100 of us. And once the numbers are getting bigger, it gives you better return for your interest and your investment in this space. So definitely a committee of practice like this is beautiful. It gives examples, it gives a ready market, and it gives those of us that are involved the succor and the support that we need from time to time.
Thank you. Leah?
Yeah, those are really good reflections, Abimola. I think, Frank, on my end, what will this forum help us to do? As we share success stories, as a funder, and I think it will really be helpful to share ecosystem gaps and also better understand system deficiencies. Because if I'm at the space of starting races, I want to know what's the next immediate problem or solution. And then this ideally would help us to effectively collaborate in the core design and core investment of these interventions. And investment, it's not only at the grant stage, it's really connecting financing across that entire continent and hopefully getting us to even more sustainable interventions and coming back to Abimola's success stories. So for me, that's really the opportunity that the forum would give us on this side. I think the second opportunity it gives is for governments also, because as you keep saying, there's a clear supply side, there's a very visible demand side, but there's a middle of an enabling environment that needs to keep the conversations moving. And this is where governments can really get us to that multiplier effect, be it aligning disinvestment and solutions towards government development agendas, really getting that those incentives to really get the private sector moving and all actors getting us that multiplier impact. Yeah.
Okay, and you bring out some really good points, because one of the things we do intend to bring as part of this community are governments. They are very core to what we're trying to do. And I think the other really big benefit, Abimbola and Leah, that you'll get from the forum is also the fact that because of our sister networks in Asia and Latin America, we're going to try and see how we can bring together similar practitioners doing the same stuff you're doing from other global South economies, and see how can we accelerate Africa's learning by listening and collaborating with people who are probably gone through the same process, maybe 3, 4, 5 years ahead of us. And so we don't have to go through the organic process of learning by doing all the time. Is that how can we learn by accelerating through others' failures and successes? And this will be a very important thing to do. Is there anyone in the audience who feels there's a very pressing question or comment to make? I'll give you 20 seconds to unmute yourself and maybe ask. If not, I'll go to some closing remarks from the speakers. We're a small group, so anyone who's feeling compelled to make a comment.
Hi, Frank. This is Wilmot. Can you hear me?
Yes, I can hear you, Wilmot. Please go ahead.
Hi, Frank. Hi, Leah. So, Frank, this comment won't surprise you and Leah, but I'm going to raise my hand and endorse the diaspora, especially piggyback on your last comment about the Global South. Look, more salient reasons in other sectors, whether it's energy, fintech, manufacturing, agriculture, African diaspora is really important because of blood. That is blood, DNA, those commonalities that are being studied and being treated, whether it's the diaspora in North America, Latin America, et cetera. So I think that what I would say in terms of all of those issues that were highlighted before, capacity, data, regulation, there are learnings that the diaspora are actually applying in underserved markets where they are right now. And at the Africa Healthcare and Biotech Alliance, as you know, we're doing that work. And then the second comment would be, I think it's also helpful, and I know you guys are both doing this, tapping into the resource of existing healthcare financiers. You know, once upon a time, not too long ago, the DFIs became allergic to sector-focused funds. And now there's an opening, and your work and others has created this aperture of opening where now they're thinking about it again. But those funds still have knowledge. There's one where you said RH Buffalo, RH managers. Here in Kenya, it's Vilgro and others. There aren't too many, but there are a few. And I would recommend engaging those guys because they are experts on all those issues that you have identified. And then also just the constellation of blended finance stakeholders now that are coming together. I have a role as an advisor on deal construction healthcare with the Health Finance Coalition. And these topics were discussed. As you know, there are efforts now to collaborate and share on these innovative strategies of finding solutions that are right for the health entrepreneurs in the African context. Thank you.
Wilmot, thank you. And Wilmot, I think your presence in the forum will be phenomenal because you'll bring in quite a bit of experience. And this is what the power of this forum will be, is just learning from each other. There's so much that's happening in our content that we don't know about because we are just not connected and not talking enough. And that's what the power of the forum will just be, how we can tap into each other's networks and knowledge to really expand the broader body of knowledge amongst us as a community. Kennedy, your hand is raised. If you don't mind unmuting yourself and asking, and then we'll have a closing remarks and one or two things before we wrap up. Kennedy, over to you.
Yeah, thank you very much, Frank. It's been a very good insight to learning how, as an entrepreneur, also from Abimbola saying, if not going to clinical, how can you break even into the other sectors? So it's a bit of knowledge for me to see how you can also assess funding for entrepreneur, as this is what I also plan to do. But however, the African continent is also faced with a lot of insecurity issues and a lot of investors. How do they want to actually see the profit for formal profit, or how to get profit for this? So this is dynamic on how we want to see sustainable means of getting financing. Even within countries or African countries, it's difficult because low credit facilities, before you can assess all these things, you might also have basic assets, or even the high employment rate is there, poverty rate is there. So out-of-pocket payments are high. So it's a very angel investors, not within the localized continent, out of Nigeria, or you want to go online, search them. But then what is worrisome, because when it comes back to your continent, a lot of high players, the government, the policymakers still play key roles in all this. So a lot of youths are 40% population, for example, in Nigeria, adolescents. How do they actually access this funding with stress, with ease? Because there are a lot of innovations, there's a lot of implementation strength. The data is absent and the data systems are absent. I work with the government, but we'll also try to see how we can strengthen monitoring and evaluation by developing the monitoring, evaluation, and accountability learning plan. Very, 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 very cost effective means to see how you can improve health service delivery, but you need a lot of resources to put all this in place. So you just good insight on how you can access the funding, but insecurity issues is a discouragement and is a factor for how. So providing care in fragile, conflict-affected and vulnerable settings is also a means of also listening on economic resilience, healthcare capacity, healthcare funding, and education. All these are energy. All these are things we also plan to do, but we have limited credit capacities and assets within the country. So it's a good insight to learn, and I'm also open to also follow up with webinar series. Thank you.
Thank you, Kennedy. I mean, we appreciate doing business in Africa as a challenge. But one of the things, and this is why, to the point where we want local commitment and local players rising to being the problem solvers. We've lived the problems. We need to live the solutions. And it's not going to be easy. But this is where, the glass is no longer half empty, it's half full. A lot of what were traditionally really stinky and big problems in Africa are now attractive impact opportunities. And if we just get creative and collaborative with how we package these problems, how we package financing, when do we apply what kind of financing, when do we apply grants to kind of test solutions to some of these challenges, and when we advance some of these innovations through the continuum so they can get more sustainable commercial capital, is what we're trying to achieve through this forum. And that's why this forum is going to bring together providers of grants, debt, and equity, take them through a training program so we can all get up to speed with those whole innovative finance, impact investing space, and also get to connect with social entrepreneurs who are trying to solve the same problems, to understand what is the context in which they operate. And so as we design our financing tools, then very much in the framework of what we know entrepreneurs are needing and are going through at the moment. So before we go to closing remarks, Abu, do you want to do a quick summary of some programs that AVP is doing? And then Leah and Abimbola, I'll come to you for just a wrap up of your comments. But to the audience, thank you so much for staying. Just hang on to us for another 3 minutes, and then we'll wrap up. So Abu, do you want to put up those slides quickly? It's just a single slide. We want to show something about the upcoming programs, because we've had some queries about what programs are these that we're putting up. So Abu, over to you. And then Leah, I'll come back to you and Abimbola for closing remarks. Kelechi, I've seen your hand. I will come back to you. So the first program that's open at the moment is an Impact Investing Fellowship program. We ran this program last year. It's a 4-month program that takes in people who are making investment decisions in foundations, governments, impact funds, and are deploying grants, debt, and equity. So anyone who's working in a corporate, a foundation, an impact fund, a PE fund, even an aid agency or a DFI, this is a perfect program for you to come and understand all this that we're building upon in the space of impact investing. So that application is open. We close on 22nd of August, 19th of August. So please go to our website or follow up with us. We'll send you some links to that program. In fact, I think Abu put in a link on our leadership link on the chat. If you go into that leadership link, you'll find the program application in there. And then next slide, Abu. We're also trying to expand some of the other programs that we're doing. This is a really interesting program that we're launching with the UNDP to try and advance the general adoption of acceptable SDG impact standards amongst corporates. We recognize the significant role that African corporates play in the African economies. So to make sure that we start setting some standards of what would find as acceptable practice amongst the corporates, we're rolling out an SDG impact trainings program for corporates and other enterprises. So please look out for this one as well. The first webinar will be on July 20th, and then a second one will follow thereafter. So those are 2 programs I want you to think about, plus the Healthcare Funders Forum that we are discussing today. So in terms of closing, Abi, do you want to take 30 seconds to a minute just to wrap up your thoughts, and then Leah will come to you.
So I say this generally, and it might sound motivational, but really it is true. Africa has so many problems. Therefore, Africa has many opportunities. I see myself seeing so many opportunities every day. Abimbola, cannot handle more than a few. So I encourage more investors to see from that perspective. You mentioned half full. Really, that's how we think now. Africans can create the solutions for African problems, and healthcare has hundreds. The more we tackle them, the more the pieces of the puzzle get laid on the table, and we'll have the Africa of our dreams. Thank you very much for having me on this program.
Thank you, Bimbola. Leah?
Yeah, great comment. I think, Frank, I must say that Africa has a great voice. And the voice really speaks to a great understanding of what the problem is. But as we build the solutions, we have to peg that on systemic solutions. We have to apply a system lens, a system mind. Even as we speak to healthcare, there's no silo mentality. We have to connect all the dots in that system, strengthening. My second point, we have to build health system resilience. That has really become an almost recently reality. So health system resilience should be really close to our radar, even as we build the health system. So I think that's pretty much from me, and really thank you for such an exciting conversation.
Yeah, thank you, Bimbola and Leah. And this is just the beginning. We are going to be having a lot of these conversations going forward. And our vision is to build a community of practice that is collaborative in the African healthcare space, that is then really structuring its approach and connection and empathy towards how we mobilize and deploy capital, and how we connect with African social entrepreneurs and other opportunities presented by governments and other systemic players in the process of solving Africa's healthcare problems. So lastly, before we close up, Kelechi, did you have a question or a comment to make?
Hello, can you hear me?
Yes.
Yes, it was just a quick question. First of all, I want to really thank everyone here for the amazing work you're doing, especially you, Frank, with the team at AFPA. This is mostly a question around, so the fellowship program and the health funders forum. So one can be in the fellowship program and the health care funders forum at the same time, or they're two distinct programs?
No, they're two different programs, and yes, you can be in both. So we'll run them 2 weeks apart.
Okay.
Yeah, so you can be in both. Yeah.
Okay. Fantastic. Fantastic.
And if you need more information, check my email. By all means, send me any communication I need, and we'll happily respond to you. But everyone, thank you so much for your time. If we're around in a physical space, would have had some snacks and a cup of coffee at the moment. So please, well deserved for staying on this long. Go and make yourself a nice cup of coffee or cup of tea, and hopefully it's an African cup of coffee or African tea, as we promote consuming our own. But really glad to have you guys stay this long, and thank you so much. But let's stay in touch. We're just in the beginning of the collaboration, and thank you so much to Social Innovation partners, Shiluva and the team, for making this happen. Once again, to our sponsors, Boehringer Ingelheim and Making More Health, and Ashoka, our partners in delivering this program. We're super grateful for all the support and the collaboration efforts put to making this come alive. And thank you so much, everyone. Have a nice day and nice weekend ahead.